Hello guys, welcome back to A to Z Dentistry, a channel which features easy explanation of various medical and dental related topics. And our today's topic is Suprabony Pockets versus Infrabony Pockets, and we'll be studying 10 differences between these two in detail. So without any further delay, let's get started. Before going into detail of the differences between Suprabony and Infrabony pockets, we'll first start with some introductory part. Okay, so by definition, pocket refers to pathological deepening of the gingival sulcus, right? So these pockets are divided into two types, the first one being gingival pockets. Now these are also known as pseudo pockets, and these are basically due to the gingival enlargement, and there is no destruction of periodontal tissues in case of gingival pocket, whereas in case of periodontal pockets, there is destruction of the periodontal fibers or periodontal tissues as well. Okay, so now periodontal pocket is divided further into infrabony pockets, also called as intrabony pockets, and suprabony pockets, right? So in case of infrabony pockets, the bottom of the pocket is apical to the alveolar bone. Okay, so in this picture we can see the bottom of the pocket is apical to the underlying alveolar bone, whereas in case of suprabony pocket, the apical part of the pocket is coronal to the underlying alveolar bone. Okay, so moving on to the differences between suprabony and intrabony pockets. So here the location and definition, right? So the definition itself speaks about the location. Okay, so in first figure, this is a case of suprabony pocket. We can see the base of the pocket is coronal to the level of alveolar bone, right? So this is our alveolar bone, and this is the base of the pocket, right? This is your pathological deepening of gingival sulcus. So here we can see the base is coronal to the level of alveolar bone, whereas in case of intrabony or infrabony pockets, right? So this is one of the synonym, right? Either it will be infrabony or intrabony. Both of them mean the same thing, right? So here we can see the base of the pocket is way apical to the crest of alveolar bone, right? So here you can see the difference, right? Here and here it is way apical to the crest of alveolar bone, and the bone is adjacent to the soft tissue wall. So this is the soft tissue wall here, right? So the bone is adjacent to the soft tissue wall in case of intrabony pockets. Moving on towards the second point of differentiation, that is on the basis of pattern of bone destruction in suprabony versus intrabony pockets. So our first figure is the suprabony pocket, and this is our intrabony pocket, right? So here we can see the bone loss, right? Take a note of the bone loss. This is the alveolar bone, right? So here there is a horizontal bone loss which is occurring, right? Look at the shape of the alveolar bone here, it is horizontal, whereas in case of intrabony pockets, the bone loss is vertical, right here. So this is the alveolar bone, and this is the bone loss which is occurring vertically, right? So in case of suprabony pockets, we have a horizontal bone loss, okay, and in case of intrabony pockets, we have a vertical type of bone loss which is occurring. Moving on towards the differences in suprabony and intravony pockets in terms of the arrangement of transeptal fibers. So here this is the diagram of suprabony pocket, and here we have intrabony pockets, right? So here we can see the arrangement of transeptal fibers between two suprabony pockets, right? So here you can see there is a horizontal arrangement of the transeptal fibers. Okay, so in case of suprabony pocket, interproximally the transeptal fibers which are restored during progressive periodontal disease, they are arranged in horizontally, right? They are arranged in a horizontal fashion in the space between the base of the pocket and the alveolar bone, right? So this is a section depicting two suprabony pockets along with the horizontal fibers which are present, right? And here in case of intrabony pockets, the transeptal fibers are arranged in an oblique fashion, right? They are arranged in an oblique fashion, and not in horizontal fashion. Okay, so these fibers extend from the cementum beneath the base of the pocket along the alveolar bone and over to the crest of cementum of the adjacent tooth, right? So here the fashion of the fibers is horizontal in case of suprabony pockets, and in case of intrabony pockets it is oblique, right? It is oblique. So our next difference between suprabony and intrabony pockets is in reference with the fibers of PDL. So these are the two diagrams which are depicting the course of pedontal fibers in suprabony and intrabony pocket. So this is the diagram for suprabony pocket. So here you can see on the facial and the lingual surfaces, the fibers of the PDL follow their normal horizontal and oblique course, right? Horizontal and oblique course is there, whereas in case of intrabony pockets, on the facial and lingual surfaces, the pedontal fibers follow an angular pattern of the adjacent bone, right? So depending upon the bone, these fibers will follow an angular pattern, right? So in first case we have horizontal and oblique course, whereas in case of intrabony pockets we have angular pattern adjacent to the bone, right? And these fibers extend from the cementum beneath the base of the pocket along the alveolar bone, right, and over to the crest in order to join with the outer periosteum, right? They will follow the course of this alveolar bone and later on they will join with the outer periosteum as well. Moving on towards the next differentiating features on the basis of gingival attachment or the junctional epithelium. So here we can see this is our suprabony pocket, right? This is our suprabony pocket, and this is our junctional epithelium. This part is our junctional epithelium, and it is located coronal. This is the crest of the alveolar bone, right? This is your alveolar bone. This is the crest of the alveolar bone, and this is the junctional epithelium, right? This is the deepened pathological gingival sulcus, that is your suprabony pocket, and this is the junctional epithelium, right? So the junctional epithelium is lying way coronal to the crest of the alveolar bone, right? Whereas in case of intrabony pocket, this is our junctional epithelium, this is our intrabony pocket, this part, right? This part is your intrabony pocket, and the junctional epithelium here is lying way apical to the crest of alveolar bone. This is your alveolar bone, this is the crest, right? Okay, this is the crest, and here is your suprabony pocket with the junctional epithelium which is coronal to the alveolar crest, and this is your intrabony pocket wherein the junctional epithelium is located apical to the crest of alveolar bone. Moving on further, our next differentiating feature is on the basis of wall structure. Right, so here is again our previous diagram which is depicting the suprabony pocket and the infrabony pocket, right? Now in case of this suprabony pocket, we can see that it is having only one wall, which is the soft tissue wall, right? Which is only the soft tissue wall. Here you can see, right, this is the base and it is lined only by a soft tissue wall. Whereas in case of infrabony, we have a soft tissue wall as well as a hard tissue wall, right? A soft tissue wall as well as a hard tissue wall is also present here. Okay, another diagram depicting the same thing. The suprabony pocket only has a soft tissue wall, whereas in case of intrabony pocket it has both soft tissue wall as well as a bony wall which is present. Moving on towards our next differentiating feature on the basis of the shape of the pocket. So here you can see in the case of suprabony pockets, this is the horizontal bone loss which is present, and this is the shape, right? This is the shape, and definitely it is wider and shallower, right? It is wider and shallower. Here you can see there is more width and it is relatively shallow, right? Whereas here you can see it is more deep and it is more narrow, right? So here horizontal bone loss, of course vertical bone loss. Here there is more width, however it is very shallow, Exact opposite here, we have a very deep pocket. See, look at the depth of the pocket, but it is narrow, right? But it is relatively narrow. Moving on towards differences in terms of pathogenesis for suprabony and infrabony pockets. So in terms of pathogenesis, we already know that there are two common features which are present for both suprabony and infrabony pockets. The first one in terms of pathogenesis is that there is destruction of PDL fibers, right? There is destruction of PDL fibers, and second is there is loss of alveolar bone. So these two features are common for both the pockets. However, in case of the suprabony pockets, there is a uniform bone destruction, right? Here you can see there is a uniform bone destruction, right? Previously we have seen there is a horizontal bone loss, right? So therefore there is a uniform bone destruction which is occurring, whereas in case of intrabony pockets, angular or localized form of bone destruction, right? So here we have uniform and horizontal type of bone destruction, and in case of intrabony pockets we have localized or angular type of bone destruction. Moving on towards the ninth point of differentiation, that is on the basis of probing depth. Right, so we know that in order to diagnose a pocket, we need to ensure that there is a pathological deepening of the gingival sulcus, right? So we usually use a periodontal probe to get to know the depth of the pocket, right? So in case of suprabony pocket, whenever you are probing the area with the pocket, you will encounter shallower probing depths, right? There is a very shallow probing depth, whereas in case of intrabony pockets, there is a deep probing depth, right? And this is because of the close proximity to the bone, right? So here we can see this is our alveolar bone and this is the pocket, right? So there is a close connection between the two, very close proximity. So therefore, see this depth, it is a deep depth, right? So we have deeper probing depths, whereas in case of suprabony pockets we have shallower probing depths. Also in this diagram, I hope you can appreciate the difference between the proximity of the bone in the suprabony versus the intrabony pockets. So in case of suprabony pockets, you can see there is no proximity of the pocket to the bone, right? Whereas in case of intrabony pockets, there is a close proximity of the pocket with the alveolar bone, right? So also previously we have seen that this suprabony pocket consists of only one tissue wall, right? A soft tissue wall. Whereas in case of intrabony pockets, there are two walls. One is the soft tissue wall and other is the hard tissue wall. Now this hard tissue wall is formed from the alveolar bone itself, right? So in this diagram, it is very clear that one of the wall is formed by the alveolar bone. Moving on towards our 10th difference, that is between the treatment and prognosis for suprabony and infrabony pockets. So here is our suprabony pocket, right? So here the treatment is majorly done via scaling and root planing, right? So simple periodontal therapy is effective in case of our suprabony pocket, right? And in cases, if at all required, we can also ask the patient to undergo the gingivectomy, right? So this is the diagram, right? Here are the pocket markings. Later on, these pockets will be removed, right? So this is our unwanted gum tissue or the periodontal pocket, which is consisting only of the soft tissue, right? Here we have very less amount of bone involvement, and therefore we can ask the patient to undergo gingivectomy if at all required, and hence obviously it has better prognosis. Okay, whereas in case of intrabony pockets, we have seen there is massive bone destruction and irregular or angular type of bone loss which is there, right? There is no horizontal bone loss, rather it is a localized, irregular and angular type of bone loss. Therefore we have to ask the patient to undergo surgical procedure, mainly by using bone grafts. Also GTR, that is guided tissue regeneration, is also required in these cases, right? Because there is a massive amount of bone greater amount of bone loss which is seen in these cases. So guys, that was all about differences between suprabony and intrabony pockets. We have studied 10 major differences, and this question frequently comes as an SAQ. Also, it may be asked as a part of long answer question as well. I hope you all understood the topic very well. I'll be back with a new video very soon. Till then, this is Dr. Snehal signing off. Bye bye. Take care.